Hey, it's KindaSpoony, back with another video. We're going to be diving into hip and groin pain, especially for those of us with Ehlers-Danlos Syndrome or hypermobility spectrum disorders. And to help me out, I'm going to introduce a video by Dr. Brian White in Denver, who has performed over 3,000 labral repairs. This is from his website.
Your hip is the joint where your femur meets your pelvis. Your hip is known as a ball and socket joint. There are two main parts: a ball at the end of the femur, which fits in a socket in the pelvis. Your hip joint has to be stable to function properly. When it's injured and the labrum is torn, it makes daily activity and high-end athletics nearly impossible.
It's pretty amazing to hear that and see those images and just kind of imagine what's happening inside of me. Now, when non-surgical treatments like physical therapy, rest, and pain management aren't enough, surgery might be considered. The main goals are reshaping the ball, making sure that the femoral head is nice and round to prevent it from impinging on the socket. 2, ensuring proper fit, adjusting the socket if it's not covering the ball correctly. This might involve a procedure called a Gans osteotomy, where the socket is repositioned. And here's something really important for those with EDS to know. Our labrum tissue tends to be more elastic and doesn't hold up well to simple repairs. So instead of repairing the torn labrum, surgeons may opt for a labral reconstruction. I'll let Dr. Brian White explain it further.
It's a fascinating joint because it truly is like a snowflake. Every ball and cup are fit a little bit differently for one another, and I've truly not seen the same hip joint in years. The labrum is the O-ring that lives on the edge of the cup and surrounds the joint and forms a seal with the femoral head. It's an important structure because it gives stability to the joint and also protects the cartilage on the edge of the joint from shear force. The problem is over time, if we're mechanically imperfect or the ball and cup are not fit well for one another, eventually it can tear and break. And when it breaks down and tears or gets degenerative, it's filled with a lot of nerve fibers, and so it can really be a pain generator for people. The most simplistic form of treatment is you can just remove the torn tissue. An antiquated operation that's not good for the hip joint because you need to have your labrum. The other option is you could repair it, which you just put an anchor in the bone and you circle the labrum with a suture and tie it back down. And that can heal sometimes, but if the tissue is too small, too large, too degenerative, too beat up, too chronically painful, it doesn't always heal in a painless state. The other option is you can remove the labrum and you can make a new labrum for the patient from a graft. Or for so many reasons it's ideal because we can make a labrum of the proper size, of the proper width, of the proper substance, and reestablish the seal and reestablish normal anatomy and normal depths to the joint with this labral graft. And the huge benefit of it is that unlike the native labrum, which has this very high density of nerve fibers, this new labral graft will never be able to reinnervate to the point of what it was at its baseline. So in that vein, we've removed the pain generator and we've given them the labrum that they need for their function and for their depth and for their stability. But that labrum should not be able to feel or perceive pain anywhere near to the degree of what they felt before. And I think that's why it's so successful for relieving pain. And after all, that's why patients come to see me.
So it sounds like the best part is that this new labrum doesn't have any pain fibers. So once it's healed, it provides stability without causing discomfort. Thinking about upgrading my hips to stable, painless joints just is amazing to think of. Sometimes surgeons might also reconstruct the ligamentum teres, a key ligament inside the hip joint that contributes to stability. If it's torn or weak, replacing it can help the joint feel more secure, especially if the socket doesn't have enough coverage. Now, it's important to remember that surgery is a big decision. Non-surgical options are always the first line of defense, but if you're experiencing ongoing hip pain, it's crucial to get a thorough evaluation. This includes detailed history, physical exam, and most importantly, imaging studies. Early diagnosis and proper treatment can make a huge difference in our quality of life. After all, we want to save our joints for the fun stuff, right? Before we wrap up, here are some key takeaways. Listen to your body. Don't ignore persistent hip or groin pain like I did. Consider all options. From physical therapy to surgical interventions like labral reconstruction, there are ways to address hip instability. Remember, you're not alone on this journey. There's a whole community of us navigating these challenges together. Thanks for hanging out with me today, and if you found this video helpful, give it a thumbs up and share it with others who might benefit. Don't forget to subscribe for more Spoonie-friendly content. Stay strong and have a happy and healthy day. Until next time. As a disclaimer, this video is for informational purposes only and does not substitute professional medical advice. Please consult your healthcare provider for personalized guidance.